Survival Analysis Simplified. Essential Techniques for Health Researchers. Quick Guide. What is survival analysis? Definition: a statistical method for analyzing time-to-event data. Importance in health research. Used to estimate survival times and compare different groups. Real-world applications. Clinical trials, epidemiology, cancer research. 1. Kaplan-Meier survival curves. Key concepts. Visual representation of survival over time. Handles censored data. How to create. Plot survival probabilities at each time point. Use software, e.g., R-SPSS, to generate curves. Example: compare two treatment groups in a clinical trial using a Kaplan-Meier plot. 2. Log-rank test. Purpose: compare survival curves between two or more groups. When to use: when you have two or more groups and want to test if their survival experiences differ. Example: comparing survival rates between patients receiving different drugs. 3. Cox proportional hazards model. Key concepts. Estimates the hazard ratio while adjusting for covariates. Assumes the proportional hazards over time. How to use. Fit the model to examine how different factors affect survival. Check the proportional hazards assumption. Example: assessing how age, treatment, and gender affect survival rates. 4. Parametric survival models. Why parametric models? Useful when the survival distribution follows a specific pattern, e.g., exponential, Weibull. When to choose. If the underlying distribution of survival times is known or assumed. Example: fitting a Weibull model for survival data in chronic disease. 5. Time-dependent covariates. What are they? Variables that change over time, e.g., blood pressure readings. How to include. Modify your Cox model to account for changes in covariates over time. Example: including time-varying blood pressure in a heart disease survival study. 6. Competing risks. What are competing risks? When individuals can experience multiple types of events, e.g., death from different causes. How to handle. Use the fine-gray model to account for competing risks. Example: studying mortality from cancer versus cardiovascular disease in a patient cohort. 7. Recurrent events. Why recurrent events? When individuals experience the same event more than once, e.g., hospital readmissions. How to analyze. Use models like Anderson-Gill to handle repeated events. Example: analyzing hospital readmissions in chronic illness patients. 8. Key software for survival analysis. Popular tools.
R, Stata, SPSS, Python.
Quick tip. Use packages like survival in R or built-in functions in Stata. Example: a quick demo of generating a Kaplan-Meier curve in R. Conclusion. Why survival analysis matters. Provides critical insights in health research, clinical trials, and public health. Choose the right method based on your data and research question. Next steps. Explore survival analysis deeper with hands-on practice in statistical software. If you found this guide helpful, don't forget to like, subscribe, and hit the notification bell for more health research content.